Thyroidectomy. The indications of thyroidectomy include thyroid cancer, which is biopsy proven by fine needle aspiration, medically refractory Graves' disease or hyperthyroidism, symptomatic thyroid masses or goiters causing the 3Ds, that is dysphagia, dyspnea, and dysphonia, and for aesthetic purposes. So this is a summary of the indication, that is the 5Cs. It either cannot be treated medically, it's cancer, compressing the neighboring structures of the 3Ds. We have said the 3Ds are dysphagia, dyspnea, and dysphonia. Cosmetic purposes, compliance to cost, medication. So this is just a diagram showing the anatomy of the thyroid gland. So the contraindication is, for example, when you have uncontrolled severe hyperthyroidism, that is Graves' disease, and you are concerned when you go in surgery, you are going to have a thyroid storm. The anatomy of thyroid gland, I said before, you have to go through surgery is more of anatomy. This is a simple where we have the venous drainage, the structures around the thyroid glands, and the arterial drainage. So these are questions that I should be asking you. What's the blood supply of the thyroid gland? So we have 2 blood supply, or maybe 3, where we have superior thyroid artery and inferior thyroid artery, and maybe thyroidema. So the venous drainage, we have superior thyroid artery, the middle thyroid artery, and the inferior thyroid artery. Vein. So we have superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein. Sorry for that. So the types of thyroidectomy, you have hemithyroidectomy, subtotal thyroidectomy, where you have total thyroidectomy, near total thyroidectomy, and osteosectomy, where you remove the isthmus. So the preparation, the pre-op preparation, you have to take the TFTs, T3, T4, TSH. You have obviously to do a good ultrasound and do triads, before. You have to do a needle aspiration, that is fine needle aspiration. You have to do the indirect laryngoscopy. This is anesthetic for anesthetic purposes, to know if you can intubate the patient. Serum levels, and then you give cross-matching, and you have already blood, and then informed consent. So for you, if your patient is hyperthyroidism, then you have to render this patient euthyroidism. How do you do this? You give carbimazole 10 to 15 mg 8 hourly when the patient becomes euthyroid. In about 4 weeks, then you maintain the patient on 5 to 10 mg. You give propanol 80 mg 6 hourly, 4 to 7 days before operation, and then you continue 8 to 10 days post-operation. In addition, you give Lugos iodine 2 weeks pre-op to reduce vascularity of the gland. So post-op, you have gone in. What's the post-op management? So half hourly, you continue to observe the patient until the patient is cautiously. At the bedside, you remove the mechanical clip remover in case of respiratory distress due to hematoma, 10 ml of 10% calcium gluconate in case of acute hypocalcemia, and then they keep the patient in semi-recumbent position. In addition to, you review indirect laryngoscopy, especially when there's cord entrapment or extubation. Calcium levels should be measured regularly. Thyroid function test at 6 weeks post-op, and then you remove the drain while dry. Some organizations remove the drain when it's 30 ml or 24 to 48 hours post-op. Complication, you have immediate and late. So immediate is where you have immediate, intermediate, and late. Immediate is less than 24 hours, where you have the 3H and the T, where you have hemorrhage with hematoma formation, hoarseness or airway compromise. You go and treat on recurrent laryngeal nerve injury, hyperthyroidism, and tracheomalacia. So we do the late before we do the intermediate. So you can have a keloid hyperthyroidism in 10%, recurrent thyrotoxicosis in 5% of the patient who you went in secondary to with Graves' disease. So intermediate is 1 day to 1 month. So you can have infection, hypoparathyroidism leading to hypocalcemia. So the calcemia should be adjusted and should be greater than 1.9 millimole per liter. So how do you know the patient that is hypocalcemia? You can have convulsions, you can have arrhythmia, tetany, spasms or numbness, paresthesia, which is one of the highest symptoms in oral, perioral, and extremities, that is hand and feet. And the tetany, you know the 2 signs. I hope you remember them. That is the Chovsky signs, that is spasm of the facial muscles on tapping of the facial nerves, and Trossard sign, which is latent tetany. This is coupled spasm of on infiltrating BP, cuff over the arm.